This story explains why modern medicine works, but at a cost most of us never think about. Modern medicine did not begin with a discovery. It began with a decision that still asks something of us. A decision about whose pain could be tolerated, so that others would never have to feel it. Before insulin, before therapy, before safe surgery, there were dogs in laboratories, their heartbeats monitored, their pain recorded, and their names almost forgotten. Yet their sacrifice endures in every life modern medicine saves. Every time modern medicine works quietly and routinely, it draws from a debt that was never settled. This is not a story about cruelty. It is a story about what progress was willing to accept, moments when medicine moved forward, by asking one body to bear uncertainty, so others would not have to, and about 3 moments when medicine crossed a line, then built everything on the other side of it. At the beginning of the 20th century, diabetes was not a condition to be managed. It was a sentence. Children wasted away as their bodies failed to process sugar. Parents watched weight vanish, breath grow sweet and acidic, and strength dissolve into delirium. Doctors prescribed starvation diets, not because they cured the disease, but because they delayed the inevitable. Medicine could observe diabetes. It could not intervene. In the early 1920s, a young surgeon believed the pancreas held something missing. If it could be isolated, diabetes might be treated rather than endured. The experiments required dogs. By removing the pancreas, diabetes was induced. By injecting pancreatic extracts, researchers attempted to reverse it. Most attempts failed. Many dogs weakened, some died. Progress arrived slowly through trial, error, and loss. Then, one dog lived. Her name appears inconsistently in the records. She is often remembered as Marjorie. After receiving the experimental injections, her blood sugar stabilized. She regained strength. She survived far longer than expected. This was not a cure. It was proof diabetes was not untouchable. That single survival would change everything. Within months, insulin was given to a dying teenage boy. He gained weight. His breath cleared. He lived. Insulin moved from experiment to emergency to mass production. Diabetes shifted from fatal to manageable for millions of people. Marjorie did not witness this transformation. Her contribution passed quietly, recorded in notebooks, not monuments. But modern endocrinology begins with her survival. Years earlier, in a laboratory far from insulin wards, another group of dogs waited. They were not sick. They were not dying. They were being observed. A physiologist was studying their digestion, saliva, gastric juices, physical response. Then something unexpected happened. The dogs began to salivate before food arrived. They reacted to footsteps, to the sound of a bowl, to signals never intended. They were no longer responding to food itself, but to expectation. Learning was happening in real time. Not reasoning, not instinct, association. A neutral signal gained meaning. Repetition shaped response. The mind, once thought unreachable by science, revealed itself through behavior. From these dogs came the foundations of modern psychology: therapy, addiction treatment, trauma care, habit formation. Hospitals learned that healing was not only about organs and chemistry, but about patterns and expectation. The dogs themselves were rarely discussed. They were restrained, isolated, operated on. They were not patients. They were instruments. They learned. Humans learned faster. By the turn of the century, medicine faced another limit. Surgeons could cut, but they could not reliably repair. Blood vessels tore. Infection followed incision. Surgery saved some lives and ended many others. A surgeon believed the problem was technique, that vessels could be joined, organs could be moved, the body could cooperate. Humans were not the place to test this, dogs were. In laboratories, blood vessels were stitched with unprecedented care. Organs were transplanted, kidneys, hearts, limbs. Most did not survive long. Some did, and survival even briefly proved possibility. From these experiments came modern surgery, vascular repair, organ transplantation, sterile technique, trauma medicine. Without them, surgery remains crude, infection remains dominant, survival remains uncertain. The surgeon would be awarded, hospitals would adopt the methods, lives would be saved, the dogs would fade from the record. Modern medicine is clean now, quiet, fluorescent. Its origins were not. They were laboratories filled with uncertainty, restrained animals, ethical certainty supplied by urgency. Progress rarely pauses to remember its shape. These dogs did not change medicine because they were exceptional. They changed it because humans decided they could be used. And every time modern medicine works, quietly, routinely, successfully, it echoes that decision. History remembers breakthroughs. It remembers prizes. It remembers lives saved. What it rarely remembers is that progress did not erase the line. It learned to live with it. Thanks for watching. If you enjoyed this video and would like to see more true stories of the remarkable animals that helped shape human history, please share and hit the like, subscribe and alert bell to show your support.